oftentimes people with depression, if you have had it before, you're twice as likely as someone who's never had it to get it again.
Okay, so in the case of depression, if someone were to come and see you and say, I've got depression, or I think I might have depression, you're basically going to have a conversation with them, try to find out whether it really is that, and whether you can talk them out of it?
Yeah, so I think that's actually a really good point that you raised just now, right? Whether they do have depression or not. So I think oftentimes depression is so commonly spoken about that people will confuse just being sad. Like if my goldfish drowned, for example, and I'm upset about it. That's normal sadness. Everyone will react normally to a loss, right? That makes sense, right? But because of the way media talks about it, the way it's portrayed in TV shows and movies and things like that, all of them think that sadness equals depression, right? So I definitely need medication. I need to see psychiatrists and things like that. But that's not always the case, right? If you're going through bereavement or grief, or you're sad just because something bad happened, like Chelsea losing 2-1 to Arsenal, for example, then that's the sadness, right? It's okay. It's no issues there, right?
Right.
But if let's say it gets prolonged, right, and that's what a clinical psychologist would do: understand the scope of things, what's going on, what's happening, the history of the problem. So from there, we're able to diagnose or start to the diagnosis process. And then, as a clinical psychologist, what I do is once we have those. Everything established already, right? We try and find out what can we do about it and all that kind of good stuff.
Have you ever been able to talk someone out of depression, or they kind of fix themselves? So I think the thing about therapy that we are always very careful is that we don't say we're going to cure you of X, Y, Z. Right? We're not going to say we're going to cure you for depression or anxiety or panic and things like that. And the reason why we don't say that is because oftentimes people with depression, if you have had it before, you're twice as likely as someone who's never had it to get it again. So that means if you had it, the chance of you having it again is pretty high. So as a therapist, my job isn't to cure you of it. My job is to help you learn to manage it, right? Right.
Because fundamentally, we have to remember that depression is basically excessive sadness. So if you look at those diagnostic criteria for depression, right, you have to be sad or hopeless or feeling helpless for more than 2 weeks. So if someone's depressed and they come and see me, my job isn't to cure them of it, but to help them understand why it's happening, give them alternative ways to cope with that situation, and then you learn how to manage your depression. So you're still going to feel sad. It's not going to prevent you from being sad, right? But if you do get sad, you're not going to get sad for a year or 6 months, whatever it is. It's going to last for 24 hours, 48 hours, 72 hours. And then off you go. You're back to normal again. Like that.
Hey guys, thanks for watching. Glad you liked it. Now, if you want to check out a full discussion on all our other episodes, click right here. And of course, don't forget to subscribe.